Welcome to The Collective, where every conversation ignites a new perspective. Join us as we delve into the journeys of remarkable individuals, explore the art of growth, resilience, and the power of a shared mission as we strive to be better together. Hey everybody, welcome back to The Gold Mine. We have another fantastic show for you planned out today. I am very excited. We got Jesse here on his first time, and I am stoked. Now, while I am stoked, you should be too. Like the show, subscribe to the channel, hit the notification bell, do all the good stuff, get your emails whenever we go live, which is, of course, Wednesdays for The Gold Mine, Fridays for The Collective. If you have any thoughts, questions, comments, anything at all, put them up in the comment section. We can hit those throughout the show. And of course, if you have not yet, make sure you are signed up for the Reinforcement Loop. That is our weekly newsletter. Goes out every Sunday, except for this last Sunday, which I'm still working on today. It's going to go out today. And we will, and then you get your information about the collective as well as a little bit of brain candy to chew on throughout the week. Other than that, let's hit up Jesse. Let's learn a little bit about him, and then we can get right into the conversation. Jesse, give us a quick 10 to 15 seconds. Who are you? Where you come from? All that good stuff.
Yeah, hey guys, happy to be here. My name is Jesse Thompson. I'm a local medical doctor in Roslyn, BC, same town as Shaun, BJJ practitioner, athlete all my life, and my practice involves interventional pain management, sports medicine, longevity, and athlete optimization.
I dig it. I like it. Shaun, how's life in the mountains?
Things are great. Actually, the weather isn't great this morning, as Jesse will probably agree to, at least according to my wife, as she was stepping out at about 07:30 this morning in torrential freezing rain. She even wore like a crazy little wide-brimmed hat, like that was going to protect her against the elements. But yeah, it's not a great recreational morning here in Roslyn. But it's a great day because we got Jesse on. And now, I've got to say that I'm excited to have Jesse on. I've been quite particular about who I would, I'm going to say allow on our podcast, but introduce to our podcast as a local person. And the reason that I was excited to have Jesse on is because he's definitely a professional in every aspect of his life. Maybe we'll get into a little bit more of his background as a performer or as a high performer. He's done a number of things that I think are notable, but two things that really impressed me about Jesse and why he's on the podcast is as a professional pain clinician or a deep understanding of pain management. It's a great topic to hit for all of the veterans out there and et cetera. But Jesse is also a pretty good example or a prime example of how he applies his professionalism to every aspect of his life. And I've seen him grow as a professional and as a person and on our BJJ mats. Every year over year, he's always enhancing his game in every aspect. So I think it's great to have individuals like Jesse on that are good representations of always getting after it.
Bam. I like it. Well, let's dive right into the topic of pain. I want to get your guys' thoughts on it just in general, because I think a lot of times when we think about pain, it's almost always in a negative connotation, but at times it can also be rather helpful. It can teach us stuff. It can tell us all kinds of things. So let's pass it around, see where we go. Jesse, what are your first thoughts on pain?
Yeah, there's the classic story when you hear about pain of the people who are, quote unquote, blessed to not feel pain at all, and the hardships that brings them, and ultimately most of them die young because they're not able to interact with their environment appropriately, right? So it's a signal, right? Just like many things. And it's a subjective signal is something that most don't appreciate. So it'll be interesting to talk a little bit more about perception of pain and how we interact with it as people.
I take it. Awesome. Shaun, what are your first thoughts?
Yeah, it's a great start because it ties directly into how Chance and I basically framed up our understanding of pain. Our filter, our perception has kind of been dulled down to some degree, or has been programmed into us as young men in the military to just simply accept that pain and then expect to get more. And so, the old saying back in the day was just bite down on your mouthpiece and keep going. And so I know that isn't a great modern message. However, there are chunks of society that were programmed or were raised as, this is going to hurt, but just bear with it and keep on going. It's not healthy, but it is a reality.
I think at times probably not healthy. You're right, I think, in that realm, but it is helpful, and it does get jobs done, and it allows you to get through a lot of things, because it's almost like a wall that we all have to kind of climb. I'm digging where we're going with this right off the bat. But Jesse, you got any other thoughts before I jump into some questions I got on you?
No, far away.
Yeah. All right, cool. So I'm wondering, from your practice, what are some of the biggest misconceptions, misunderstandings that you see on a daily basis when you're dealing with people with pain?
Yeah, it's hard. My practice is divided into a couple of sections in terms of this topic. A lot of people, we are trying to solve their problem, right? We are trying to heal them and take away their pain stimulus. However, there is another large category where we're palliating a symptom, right? Where their joint is ruined. All we can do is make it feel better intermittently, or subject them to a surgical procedure that is, when you look at the results of these, is about the same, right? Like, some people come out of those surgical procedures with the same or more pain forever. So the other thing that comes to mind is, the aspect of covering things up and how people approach that differently. Some will really come in looking for a pill, right? Something to just take it away and blanket it because, for whatever reason, right? We can get into that. But yeah, I guess those are just my initial thoughts, right? My practice is split into, my first interaction with people is usually looking at what are we looking at here? Are we looking at something that's solvable or something that's not? And having that initial discussion of which direction we're going to go.
Yeah, I've had a similar conversation with a number of my doctors, and whether or not pain management is the key, or if it's if we can do something to get rid of the pain in general, which I need to talk to. I need to go see a coach about that one. Get my back sorted out. Shaun, what are your thoughts?
Well, my thoughts are pretty easy because actually I've had to have these same thoughts with Jesse because he has treated me for pain. My right shoulder, and I mean, I've got a litany, or I've got a laundry list of injuries from the military and etc. I've put a lot of mileage on my body. But this right shoulder, Jesse put an injection into my bursa sac, and because it's quite inflamed, and it was inflamed to such a degree, and I'd put up with it for so long as I can. I'm not saying it's a healthy practice to just keep on eating that pain, but I'm used to it. So if I rotated my arm like this, it was just freaking brutal. In fact, my range of motion was disappearing, and so it was becoming a problem. I went to see a specialist, and then I got referred to Jesse, or I asked to be referred to Jesse specifically. And so when he put the injection into my shoulder, we had to have that conversation about, well, what are we trying to achieve here? Are we just simply trying to manage the problem? Are we trying to make it better, worse? What is going on? And so Jesse didn't just let me sit down and he got after it. He had a full conversation with me about the if this then that's, and that injection into my shoulder that lasted for several months, and I couldn't believe how much it improved my shoulder. But as things go, and I did mean to talk to Jesse about this a couple of months ago, the treatment only lasted several months, and I was kind of back to where I was kind of originally. And so, as is my way. Now, this is an important aspect why I'm telling this full story. As is my way, as I am programmed, as I've programmed myself. The moment that this started hurting, I thought, I can put up with it. And then it got worse and worse, and then it was right back to the baseline pain. And I just kept on saying, I've faced worse. I've faced worse. I've faced worse. But it is brutal right now. Riding the bike, hitting the heavy bag, freaking picking up my coffee mug hurts. But I'm used to it. Now, am I regretful that I didn't see Jesse just before I fly overseas for 2 months into Vietnam and Japan on the 3rd of November? Yeah, I am. Because now I've got another 2 months overseas where my frickin' shoulder is brutal. But I'll put up with it. But that isn't healthy. And the last thing I'll say is the reason it isn't healthy, it's not just a structural thing. It's not just a physiological thing. It's also a psychological and an emotional thing. Like that wear and tear wears down my mind and my emotions to some degree. So there's pain as a whole isn't just that stabbing, throbbing pain that irks you when you get out of bed. It's way more than that. And the implications of pain affect you on so many levels that perhaps we should talk about now.
Yeah, we were talking with Pat a little while ago, and he was saying that I could be anything again for a day, but but the next day, and the day after that, and the day after that. And to your point, I wanted to get into this was the burn rate that chronic pain has. Is it, like you said, it's not just the fact that the shoulder hurts or my back hurts or whatever. It's the fact that you can't do certain things, you lose range of motion, you're unable to enjoy certain moments because you're just constantly burning that suppression. That like, no, we're staying down here. It's killer. Jesse, you got any thoughts?
Yeah. I mean, I would liken that to sleep deprivation for anybody that hasn't experienced pain for a long time. I've got 3 little kids, 2, 4, and 6. So sleep is often hard to come by. And yeah, just that socio-emotional impact that it has on you unconsciously, right? If you have 2 hours of sleep versus 8 hours of sleep, how are you going to handle, each fleeting moment of the day is going to be different, right? And same with if you have this underlying, whether it's a mild, moderate, or severe level of chronic pain, it's impacting you.
Shaun, you were a coach for many years as well. And I mean, how would you manage your athletes when they were dealing with this burn rate? I can see the smile. I want to hear this story.
Look, okay. The worst chimney sweep in the town is the chimney sweeper himself. He's got the filthiest chimney. Everyone else has got a clean chimney. He doesn't. And that's the way it is for me. So, like, I'll give the advice, but I often don't take my own advice, and that is hypocritical, I know. But I've told many athletes, don't be me. My own sons have said it for years. Like, it's a bit of a running joke in our house because they observe me doing it, and I've said it so many times to them, boys, don't do it the way that I do it. This is not the right way to do it. I've got decades of doing it this way, and now I'm used to it, and I know I should change my ways, but don't be me. My boys have got a saying in the house that's called, don't be dad. And I'm okay with that because I want them to understand that I'm not setting like the perfect example. My way is not everybody's way, that's for sure, but I'm used to it. I do need to change my ways, but I can't change my ways in such a way that I'm now inauthentic. So I have a core essence that believes in certain things in respect to pain and getting things done. Whether it was programmed into me or whether I was born with it is neither here nor there. It is what it is, and I need to change it. However, for right now, I like a little bit of pain from time to time.
Do you guys think that? Do you think it is a necessary thing in life to go through these periods of pain or to have chronic pain, or like, do you think that we could go through and have a relatively successful life without it? Jesse?
It certainly makes you appreciate things, that's for sure, right? It's like when you have a cold and you've got a sore throat that's taken forever to go away, and you're just like, I just want to swallow without having pain. What does that feel like, right? And so when you got this burden, right, and if you're lucky enough for it to go away, I mean, you really appreciate things differently. I've had the same shoulder problem that Shaun has now, and I was a little bit smarter in getting it managed faster. But I know what it feels like, and it is brutal. And it's really nice to be able to move my shoulder without feeling anything now. I'll tell you that.
I still don't know what that's like. Both my shoulders are jacked up, and I got pain all over my body. But like Shaun, I've grown accustomed to a lot of the pain. And what I do for pain management right now is I use CBD, THC, to kind of helps me keep the pain at a low enough level that I can still manage the day. I can still do all the stuff that I need to do without being overwhelmed. But there are times when you get like an acute flare up where I'll lift something wrong, or actually the last time my back went out was I was trying to get out of bed. Like I just sat up from bed and I went right back down. That was it. But those spikes versus the chronic pain, is there a difference in terms of the nervous system, the neurological processes that go on in your body, or is it just kind of the same nerves firing? Go right back to you, Jesse.
I think it really depends on the physiological process that each person's exposed to. Uh, here's one side of the picture, right? I'll see a consult on a patient who's had back pain for 30 years. It can't be fixed. It's hopeless. We're going to just palliate this and manage it for them. And then, I see them with the rehab guys and we get them moving a little different, loosen up some muscles, and then all of a sudden it's gone. Right? Like this can happen where they've been failed by the system a little bit. And on the other hand, you'll have the opposite where, you've got crippling arthritis or just something that the clock cannot be turned back on. And you'll have these spikes of pain due to inflammation. And it's not the same nerve fibers. It's not the same pain system during those spikes in these situations. It's more of an inflammatory explosion that recruits muscle spasm and different things to the picture rather than the low grade regular arthritic pain that people might deal with from day to day. But every case is individual.
That's good to know. Shaun, you got any thoughts?
I do. It is so individual that it not only does it require individual care, it requires team individual care, in my opinion, if you're going to fully address the problem. And that's one of the things that fascinates me about Jesse's practice, which is the reason it fascinates me, because for our small town or a town of this size, I think it's unusual for the kind of model that he's created, whereby he's gathered a number of specialists under one roof. But what, again, is different is, as I understand it, 2 medical professionals will attend in a session, 2 doctors that have complementary but also non-competing spheres of understanding. And therefore, when that's combined, it's more of a 3-dimensional model rather than a 1-dimensional perspective. And so pain as a whole within your system, Chance, and my system, you'll understand it through the medical system differently than I do, because of course this more perhaps progressive approach in our town of combined forces dealing with one problem.
I like that. I've said for many years that I think the military needs to have these setups so that you have like chiros and physios and massage therapists and acupuncturists and things all in one little shot, so that all the dudes on the base can go see them and get it sorted out. But Jesse, you want to run us down a little bit, like in your practice, what that looks like?
Yeah, absolutely. So we've got a pretty big team here for the little town. But what Shaun's referring to is some coordinated care rehab visits that we've been doing. So I'll have my good friend. He's a chiropractor. He works at our office full time, and he'll see a patient, bring them to me. We'll see them together. It's, we're going to kind of live in the center of that Venn diagram of skill sets, right? He's very much surpassed the usual role of a chiropractor, and he's moved into a lot of fascial manipulation, active rehab, learning, and one of those guys that's constantly learning new things and expanding his skill set. So we have had great success with that model, and people are doing really well. We've also got a nutritionist and exercise physiologist on staff, yada, 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 like more people to support if needed, right? Because as we've already mentioned, pain can come from a lot of different angles and be blamed on many different things in the patient's lifestyle. So we're trying to keep it broad, but cover all the bases. And it's been going great.
That's awesome. I'd love to have a little place like that. I have to do, like, I have my chiro set up with a group over here, and then I got my massage therapist down there, and I got and it is it's excruciating the amount of time it takes for me to get to all the places versus being able to hit just one.
Yeah, but other than the inconvenience, which it is an inconvenience, it is time consuming to go to 3 different offices. That isn't the actual issue. It's the lack of collaboration on the individual. 3 minds looking at one individual is a totally different thing. And so it's that communication, that coordination that I think is critical. Something that Jesse had mentioned there about pain made me want to state to the obvious to us, but I think it bears stating for the audience. The issue of pain amongst veterans perhaps is that it holds us back from doing certain things. And that has an actual social toll. So my case study, using myself as an example, would be because of my freaking stupid shoulder, more correctly, because I'm stupid and I didn't get it sorted on a consistent basis. I've been off the BJJ mats. I should be on the BJJ mats. I love the BJJ. I love all the martial arts. Because of this cronkified thing, I don't want to get on the mats and hold everyone back because I'm moaning about my stupid shoulder. Like, my head explodes just thinking about a Kimura or an Americana startup on this side of my shoulder. So, like, it's kept me off the mats out of maybe even an overabundance of caution because it's just so bad right now. But it sucks because, Chance, if you don't get to do the things that keep you, good to go, then it starts to drag you down a little bit. So it's not just the pain aspect, it's the disconnection from some of the things that you used to be able to do that you think now you can't. Make sense?
Absolutely. When I first started BJJ, actually, I kept messing up my back. I would go too hard, too fast, too soon, and I'd be spazzy, right? I'm a white belt. I have no idea what I'm doing. And it would take me out for weeks. Like I have a herniated disc in my lower back. So that would flare up and I could barely walk. I could barely move. I would normally not be doing BJJ, but I would still go. Like I would go to class and I would sit there on the side, and it was one of the most psychologically painful things because I want to be on the mats doing the thing. But by being on the outside, I was able to learn a lot of lessons. I could watch everybody else move, and it helped my BJJ in the long run. But you're right, by separating yourself, that's, I think, where people quit. You initially try it out, you love it, it's a great time, I'm super pumped, and you can put this in anything. It could be running, it could be wrestling, it could be cooking, it could be whatever. You hurt yourself, and then you don't touch it for a while, and then it's harder to get back. It's harder to get back to the thing that you want to do because other people have surpassed you. Jesse, you got any thoughts on any of this?
Yeah, I mean, like what you're describing is not the way that most people would handle things, right? I agree with you that most will quit when they're faced with a challenge, right? And that's a whole separate issue. But yeah, you're just finding the positive in the negative, right? When you're sitting there on the sideline learning something, and I think that's an asset as a person.
It definitely it helped quite a bit because I was able to start noticing how the higher belts were moving. Allowed me to watch the instructors a little bit more rather than, because we all know, right? You sit there with the instructors, they show a move and they're like, "Okay, now everybody do it," and everybody claps, and whew, you have no idea what you're doing anymore. Shaun, you got any other thoughts on this?
No, I just, again, want to reiterate the fact that for this particular thing, the pain is less about any shoulders and it's more about the disconnection perhaps from your social group. And so I'm stating that because you really should double down on resolving your physical ailments in order to get back to that social connection.
I 100% agree. So, well, then how do people do that? What's best practice in your guys' opinion? What is best practice for being able to understand what the pain is telling you and then move forward? We'll go to Jesse. What do you got?
Well, I mean, this is in my personal life, this is a lot different than what the average person might be able to do, because I understand the processes a lot more, right? Got like kind of an inside track on what's going on, and a lot of, like, I have an ultrasound in my office. I have these things at my disposal to figure out my own issues. But yeah, I think, I've had a bit of a shift in the last 3 years of my practice from a lot of palliation and standard medicine more towards regenerative and fixing problems with rehab and movement patterns and things that I didn't even know existed, like fascial manipulation a couple of years ago, that have been huge. Not maybe not for myself, but for a lot of my patients. I'll give you a good example. I had the recurrent shoulder problem that Shaun's been having for a while. And it wasn't until I actually had someone take a video from behind me doing a pull-up that I noticed that my muscles in my back, my lower trapezius, was half the size of my other one from my childhood career in archery. Like from 6 till 20, I was competing at the national and international level. And it's just that asymmetry of pulling a bow over and over again, overdeveloped one side, underdeveloped the other. And that ended up being the reason for the shoulder problem. Was the imbalance in the mechanics in the shoulder caused the impingement. I fixed the imbalance and the impingement is gone with, no medicine, no nothing, right? And so there is no more pain there. It wasn't a psychological thing. It was a mechanical thing. However, if you let that go long enough, that turns into a permanent situation. So, it's really hard, right? I don't think that I would have figured that out if I was a civilian, if I didn't have, this coordinated care recommended to me. And so decision-making would vary widely amongst people with that situation.
I can't tell you how valuable filming yourself doing stuff is. I've filmed myself doing BJJ. I film myself doing Muay Thai. I film myself playing guitar. I film myself doing all kinds of things so that I can then see exactly what's happening. Because I think when you're in it as well, you never really, it's hard to get those cues unless you know what to look for ahead of time, right? And that's a big part of it. Shaun, you got any thoughts?
Yeah, I agree that video is a great tool to third party yourself. I want to go back to something that Jesse said, and the cost of pain management versus the cost of your life. So, as we're starting to talk more about treatments, there may be some people out there thinking, well, this kind of sounds like it's sort of fancy. It might sound expensive. It might sound unnecessary. But then you have to run the numbers of your life. And so and I should have gone and seen Jesse sooner, again, for another treatment on the shoulder, but I didn't. But I know the cost. And it's not a financial cost per se. It's more of how am I managing my life cost? And so at 62, I know that I've maybe got another 20 years. And I'm willing to accept a certain amount of discomfort and inconvenience based on knowing that I've only quote unquote got 20 years. But, if I was in my 20s and I was dealing with the shoulder, there's just no way I'd be sitting on this thing, chewing on my bottom lip, wishing that it would go away. I'd get on with getting it treated. So at what age and on your circumstances within your life can start making some of these decisions. So I'll get back to how I started, and that is, if it sounds expensive, are you going to get it done? If you've got the means, yes, you should, because the quality of your life that you're going to get on a day-to-day basis is always going to pay you back for the money that you spend. So math on all of these treatments, math against your life, it's something that you kind of got to do in order to make your decisions. And I'm curious about what you think on that, Chance, because as veterans, we have certain things covered, but then we don't have other things covered. And with families, you have to kind of not pinch the pennies, but the pennies count. And so these considerations are kind of important, no?
Yeah. Not only that, but also the time, because you have limited amount of time to spend with your family and your kids and things like that. And if you have to spend an hour with the chiro and another hour with the massage therapist and another hour with your physio and another hour with your on the BJJ mats and another, like those, that takes away time from your family, but also the physical cost of it and the actual dollars. These are pretty expensive treatments. So you need to be able to, like you say, do the math. I think that is really understandable. The saying that keeps floating around in my head is you have your health. That was a big thing when I was a kid. That's what when I would complain as a child, my family members would be like, "Oh, but you have your health." And at the time, when you're like 12 or 13, you're like, "Whatever." Like, I'm perfectly healthy all the time. You don't really understand what it's like to be in pain or sick or really ill, where you're in the hospital, kind of stuff. Until you do. And then once you experience it, then you go, oh, right. As Jesse was saying earlier, it makes you appreciate when you are healthy. But as veterans, man, we get a lot covered. If you have a Veterans Affairs claim, you can get pretty much anything covered as long as your doctor prescribes it. So if you have a good relationship with your doctor, you can flat out, hey, can I get a prescription for physio, acupuncture, et cetera, et cetera, et cetera, all the way down the line. And the VA will cover quite a bit of it. Jesse, do you work with the VA at all? Have you dealt with them?
Yeah, I've dealt with pretty much every insurance company and payer. And the only thing that I would say about that is, yes, it's important to seek out treatment, and but it's hard because I've seen people go through. WCB is a good example. You get hurt at work, they put you through a program that has you see physiotherapy every second day for 2 months, or something of the like, and you come out no better. And then you come to it to look at it from a different angle. Say they come see us, and the person is fixed immediately, right? This has happened before. You need to seek out a good quality practitioner, right, from whatever discipline. Don't just go to say you're getting physio. Don't just go to say you're getting massage therapy. You have to go to someone who's invested in making you better in some way, and as at least transparent. If they're saying, okay, like I understand we're not going to fix this, but this gives you a week of improvement, and you agree that that is worth it for the time and money, that's our understanding, we're going forward. But so many people just book their physiotherapy appointment. They go, they see somebody once a week. They've been doing that for a year. They are no better. They're not having any advantage except, and they say their benefits pays for it, but you do have the cost of your lifetime, right? And being there. So I stress this a lot to patients. Make sure you're seeing someone of high caliber that is shooting you straight.
That's a great point. It reminded me that this is not just physical as well. So vets that are suffering from post-traumatic stress, if you have your psychology and you're dealing with pain, but that's not something that's covered through the VA from a different injury or something like that, a lot of times your psychologist can write a prescription for the physio or the kinesiology or the whatever it is for the benefit of your mental health, because the pain will be taken away, which is another little bonus point, which is awesome.
Yeah, that's another world that we are just starting to kind of learn more about. And this will be extremely interesting to you guys. Something called nociplastic pain. I don't know if you've ever heard that term before, but essentially what this involves is a traumatic incident reprograms your brain, and all of a sudden you have chronic pain everywhere. This is the person who's been in a minor car accident, and all of a sudden they have full body chronic pain. The person who, even if they were blown up and now everything hurts. It doesn't make any sense, right? We're chasing things around. We're trying to find a solution, but there isn't one. It's in the brain, right? And so there's interesting therapies reprogramming this. Like I said, I'm just kind of starting to learn about this, but it's fascinating.
I want to hear about that more, because I have been blown up a number of times. I've been blown up once, but been around a lot of other explosions. Shaun, have you heard this before? Anything?
Well, that makes two of us on the being blown up and all the explosions, but I haven't heard the term before, but I'm glad that Jesse brought it up, and here's why, because it made me think that, we're kind of talking about pain from a generalistic perspective, but there are some specificities that I would like to touch on, and this is one of them. The emerging science between explosive forces or hard concussion forces on the gut-brain connection, and how the disruption of the gut from these kind of effects are causing a lot of issues in respect to pain. I know, of course, with operator syndrome, Chance, with Dr. Chris Frey, this has been a part of the subject as well. So for veterans specifically, I think that there are a number of avenues that are yet to be discovered in the sense of modalities that can perhaps treat or alleviate some of this stuff. But I'm stoked that Jesse's looking into this new area. But it doesn't surprise me. And to maybe add a little bit of weight to his point, you do have to find good practitioners. You do have to find people who are invested in you. But the third piece is they have to be invested in themselves. They have to have a freaking curiosity, man. Like when Jesse said, and I made a note of it, I've got an ultrasound in my office and I can just check out what's going on with me. No, you can't, unless you've got a curious mind. That ultrasound machine doesn't exist unless you've got a curious mind, and Jesse does, so therefore he can do what he says. And that is the case for all of us. I don't have an ultrasound machine in my office, but I've got a freaking curious mind, and I've looked at a lot of things in order to address my needs and address other people's needs as a coach or as a human. Like, I want to know more about how to become a better person. And so if Jesse's on that same track, it's when you're lined up with people who are moving in the same direction of you with the same values, the same passions, the same curiosities. I think that's the mark of a good practitioner, or someone who's looking after your health. They're in the game with you rather than there to receive you, check the box, and then 2 months later show you the door and you're none the wiser.
This goes into, it reminds me, my massage therapist does this quite often, and my chiro does it, and my physio does it. Usually what the pain center is on me is not usually where the injury is, right? So like if my back hurts, it's usually not the back that's injured, it's something else that is putting everything else off kilter, and then that overcompensates, and that overcompensates, and that overcompensates, and then I get pain in my knee, things like that, where it rarely is the problem is rarely usually the thing on the face of what's being presented. And the curiosity it takes to kind of follow the string back to where the actual problem is has been extremely helpful for me, because I found out all kinds of things about how unstable my body is. Let's put it that way. Jesse, you got any other thoughts on any of this?
Yeah, that can definitely happen. Like we're learning a lot about fascial things, like I was saying, but this is just one example of how the body's connected, right? And Shaun mentioned earlier the gut-brain axis, huge area, huge hole in conventional medicine, right? We're throwing neurotransmitter medications at people left, right, and center, and not looking at their diet, how many antibiotics they've been on, what kind of concussive forces they've been exposed to, when they're coming in with mood issues, right? So, just to reinforce that everything is connected, and you can't take something at face value.
So let me ask you this question, and Shaun, you touched on it earlier that you and I come from a bit of a background where we just suppress pain and get to work. But years ago, before any of these things were sciences, people would do that for life, right? I look back at I was just down on my family's ranch, and I look at my uncle who works cattle every day, no break, no days off, no nothing, always working. He has suppressed pain for many, 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 many years. And modern society has kind of tripped us up into not understanding or not being able to endure pain. And I think maybe leaping at the first sign of discomfort and trying to get away from it. Do you think we've lost some of our capacity, or like from previous generations, or do you think that we just don't need to let it get that bad before we go see somebody? Jesse, I'm going to come right back to you. What do you think?
Yeah, there's a lot of outs, that's for sure, right? When it comes to work and accommodation. I think all I can say is if you're not the one experiencing it, you don't know what the experience is. And there's a lot that shapes that for each individual person. Like one, hypothetical example is, somebody comes in, I have pain all over, you have these things to explain it, but, I see people that have these things all the time, and they're not in the situation where you are, where you need to be off work. Oh, but, you have an autistic child and the other one's is on chemotherapy. Like obviously you're going to be dealing with this a lot differently, right? So it's a case by case example. I sound like a broken record, but it's individualized. But I just to answer your question, right? Like there's a lot more accommodation, right? Whereas maybe in the past, it just wasn't an option. So you just continue on, like you're saying about your uncle, right? There's no option. You gotta feed the family. You gotta keep the property running. So onwards you go. And I think we still have some of that out there. But with a lot of our industry, there's so much accommodation, which I suppose is hard to argue against. But sometimes it's hard to argue for as well. But again, case by case, right?
I dig it. I like the fact that you keep hitting this over and over again, because I think a lot of people want a cookie cutter answer. They want the pill, they want the book, they want the whatever to just fix the problem and not have to worry about it again. But it is such an individual thing that I think it needs to be hammered in. Like, we got to beat this dead horse that it is. It is a case by case basis. Shaun, what do you got?
Well, it is a case by case, and it is a result of your history, and it is a result of where you're trying to go. And so, when I got out of the military, when I left Tier 1 Special Operations, I had like this, I had a bunch of things going on in my body that sucked, but I had this wicked, insane pain just above my right trap. And it was deep, deep, deep inside, like almost on my spine kind of feeling. And as it turns out, I have a bunch of cronkified vertebrae and et cetera. But at the time, I didn't know that. I just had this freaking pain that was driving me crazy. And it was so bad when I left the teams that this shoulder, my right shoulder, I was walking around like that almost. Now, whether it was somatic or whatever it was, that's neither here nor there. The fact remains that I looked like I was walking around like that. That's what I felt like. But it was probably only just that. But it was definitely raised. So I got out of the military. I'd never seen a chiropractor, ever. A few weeks out of the teams, I thought, man, I got to do something about this. I don't know what I'm going to do. I'll try a chiropractor. I walked in and he said, so why are you here? And I explained, can you see my shoulder? And he says, it looks a little raised. I said, in my mind, it feels like it's touching my ear. And it's super uncomfortable. What can you do about that? And he said, 10 sessions. You'll come here every week. By the end of it, you'll be fixed. I was like, okay, how much? $1,000. Done. Drop $1,000 right on the desk. And 10 sessions later, I was $1,000 poorer and none the wiser. It didn't do a thing for me. The guy didn't interact at all. I spent more time sitting in the office than I did on the desk, or sorry, on the table. The treatment took about 2 minutes. It was a crickety crack, and he said, you probably feel better tomorrow. See you next week. That was about the extent of our relationship. Couple of sentences, and then I waved to the ladies at the front desk on my way out. He didn't know my name, really. I didn't really know his. It was the worst $1,000 that I ever spent in the sense of return, but it was the best $1,000 I ever spent out of my own wallet to realize that not everyone is the same. Not everyone provides the same level of care. And by the way, acupuncture may or may not be for me. Chiropractic may not be for me. And I had to start making some decisions, ill-educated decisions as to where I should go. At the time, what I couldn't find was someone perhaps like Jesse, who has a fuller perspective of what I could have engaged in at the time and is more accommodating or more explanatory on my options and maybe prioritizing the sequence of events. There was none of that back then. But I know it exists now. And I'd just like to say for the troops who are listening to this, don't just randomly dabble. Don't just like do this, try that. Try to find an expert or someone who is there for you to look at it as a big picture treatment plan, a holistic perspective to the problem. So that's my advice based on this stupid thing that I had way back in the day.
When I was younger, it used to amaze me when you'd see people kind of like walking hunched over, and you'd be sitting there going like, how do they not know that they're hunched over like that? And then similarly, I had the same thing. I was walking with one hip higher than the other. I would kind of like be off kilter, and I was just doing it to alleviate a little bit of pain. Same, like that little bit of shoulder difference alleviates just that little bit of pain. And it's easy to just let it become how you live at that point. It's tough. I got another question here, but Jesse, you got any other thoughts before we jump on to the next thing?
No, go ahead.
All right. So this is a very broad question, and I know you're going to come back at me and probably say that it's a case by case basis, but what does healing look like? Like when somebody is done, for me, it's a lot of the issues that I have now aren't going to be 10 sessions and check mark, you're good to go. A lot of them are just chronic management. I'm just managing the pain itself so that I'm not crippled in bed. But to me, that's what healing looks like right now. When, as a practitioner now, when you discuss this with patients, what do you tell them? What does healing look like?
It's a good question. If let's just say it's you, this is the first time that I'm seeing you, like I need to look at your perspective on those things that you're complaining about and make my mind up for myself that that's true for you, right? I don't know who's told you what you know, but I don't have any confidence in that until I decide for myself with my team, right? So yeah, that's the approach that you've learned because it hasn't been addressed from another light. So for you, right, like if that is in fact the case, it's coming to terms and functionally being where you want to be, right? So we talked at the beginning about the burn rate of having the chronic pain or chronic insomnia or whatever you have in your life, and accommodating that the best that you can. You find the tools that are available, but ultimately you have to come to peace with it, like socio-emotionally, before you can stop being bothered by it in your day-to-day life, right? So that's the chronic pain healing journey. And a lot of patients who I see that are dealing with those true insatiable problems, I send them to a coach or a therapist. We use a coach, but and she's excellent, and we have her as part of our team. But a lot of the times, people, like I said, it's individual. People come with the mindset that you have, and we find a way to make them feel longitudinally better, right? Things have been missed. So it's really hard when to know when to stop turning over rocks, I guess. And I don't know, like when there's things that I miss, I'm certain, right? So when do you stop turning over rocks and start accepting what you've been dealt, I guess is a better question. And at that stage is when you have to start looking for some internal and external help.
That's a good way to look at it. I stop turning over rocks. I've been told one of the things I know for sure I have degenerative inner ear nerve damage. So there was a point where I had to just like, I need hearing aids. I got to wear them every day so that I can actually hear the people around me, and that's just the way it is. But that little journey just to that took a while. I'm like, oh, what a bit. Shaun, you got any thoughts on this?
Yeah, it was a good question, Chance. I hadn't really considered defining the quote unquote end state of healing. But as I was thinking about that, it made me realize perhaps that obviously, well, I say obviously, perhaps there's no end state. And so maybe to your question, my answer would be the healing journey is actually a journey that just never ends. And so I'll use an example using myself. I go to acupuncture, Chinese acupuncture twice a week. Generally speaking, I go down to see Pine and Needle Wellness 20 to 25 times a year. And I've been doing that for about 5 years now. And so I've got a ton of acupuncture from that practitioner, and she's awesome. And why do I keep going back to her? Because when I first started seeing her, it was for an entirely different reason that we resolved. But does that mean that I'm healed? I don't think so. I think there's more to uncover. And so, to Jesse's point, like, how many stones do you unturn? It is a fascinating question. But then, should you ever stop unturning them? Which is also a fascinating question. And every person, as Jesse has been saying, is boutique, is unique. There is a different answer for each person. Now, for me, a journey is maybe lifelong. And so, with acupuncture, I'm like, over the last couple, 3 months, I've been working on an entirely different thing with her that is more neurologically, athletically driven rather than really old chronic issues that I had, several years ago. So I think the journey, the treatments with a good practitioner are evolving with your incoming health needs rather than the one thing that you went there for 5 years ago, you're still being treated for.
So let me ask you guys this. It's going to be a kind of an interesting question, and then we could probably do our final thoughts. We're running out of time, but I'm gonna use this. If pain could talk, what do you think it would want us to hear? What do you think that it is trying to tell us on a regular basis? Jesse?
Interesting. Like I said at the very beginning of the hour, it's a signal, right? It's trying to communicate something, whether that's stop now because you're doing damage, or accommodate, right? Or like if it's adaptive in some way, right? Like, you're pushing hard. This is your feedback for that. But it's our RPM gauge at sometimes, right? Like on a car, you can take your car to the red line, but you can't hold it there for long. So getting to know what's coming from your own body is the most important part there from my perspective. Because if you go from 0 to 10,000 RPM, you pretty much know that you need to stop right away. But if you're kind of slowly edging things up and you're holding it around 8,000, you know how long you can hold that, right?
And you can shift gears. I like this. This is a good analogy for the RPMs. Shaun, what are you thinking?
There was an old saying back in the day. It was more of an infantry thing than it was perhaps the entire combat arms. But Chance, I'm sure that you guys threw this one around a fair bit as well. Pain is a sign that you're still alive. That used to be a freaking mantra back in the day. And I mean, like, if you were feeling pain, it was like not a bad thing because you were still hanging out. So is it a good thing? Is it a bad thing? I think, again, as Jesse's been saying, it's unique to the individual. But I've tried to treat it like a familiar partner, not a friend or an enemy, but something that I'm familiar with. And is it a red flashing light on the dashboard of my life? Sometimes it is. And sometimes it's just a sign that I got to push a little bit harder to see if that thing is going to flash faster because I am curious. I want to know what I'm capable of as a human being. In fact, I put up a post this morning just before we came into this podcast, recording this one. And it was, I literally used the term possibilities. The etymology of possibilities is to do or to be able to do, rather than what the term nowadays means, which is, I hope you can, or maybe you'll be able to. But I was raised on possibilities mean freaking make it happen. And so my body, I want it to make things happen. And so I'm willing to accept an amount of pain in order to have possibilities. And so I'll leave it with that.
I like this concept of possibilities, and I'm stuck on the RPM gauge as an allegory for pain, because in order to do anything, if we want to achieve anything, there's going to be a set amount of pain, whether that is physical or emotional or psychological. Or, I mean, the benefits of marriage come with the opposition of pain. There's going to be some learning things that you got to do as you're muted there, Shaun. I can't hear you.
I was just saying, be careful.
Yeah. But you know what I mean, right? Everything that we do, if we go work out, there's a little bit of pain when we're lifting weights themselves, that you're gauging off of the RPM. Whereas if you pick up a weight and you get a friggin' 10 out of 10, well, yeah, it's probably either too heavy or you're not doing it right, or et cetera, et cetera. But if it's a 2 or 3 and you're getting a pretty good feeling and the stresses that's happening, it allows you to understand what you're doing with. But I love this. This is great. Jesse, you got any other thoughts before we go to some other things? What do we got?
No, go on.
All right, cool. I got one last question, and then we'll hit up the final thoughts here. But I want to know what your guys' greatest lesson has been. Let's put it that way, in regards to pain throughout your own life. What is it taught you the most? And I'm going to start with Shaun on this one. What do you think?
I'm going to go straight to what entered my mind immediately. Pain as a topic, or pain as the word, the idea, hasn't taught me as much from my own pain. It's observing other people's pain that has taught me the most. And so I've been privileged to be in a position where, as a directing staff or as an instructor of particular things, where I've got to, or I have observed, like wheelbarrowfuls of pain across a body of man. And being able to see the amount of pain an individual is willing to accept, not for themselves, but on behalf of the team, that is something that has a certain power to it. So pain as a whole, we've been kind of referencing it, not negatively, but, cautionary perhaps. I'll just say that when I've observed pain, a body of men absorbing it on behalf of something larger, is pretty powerful. And it is something that if you get to stand in front of it, it'll change your life for sure, your perception of pain.
I like that. Jesse, thoughts?
Yeah, I'm going to take a different angle and say that what I've learned the most is mostly personal, and not just physically, but in relationships, in business, emotionally. The lesson is, you get dealt something, it hurts. What will you do with that? Right? Like you can grow, you can get better, or you can succumb to that. So I think, whatever lens you look through pain at, from, like I said, emotional, relationship, physical, what are you going to do with that? Are you going to make the good from the bad, like you were talking about earlier? Or are you going to catastrophize and let it rule you?
That's a great way to look at it. My thoughts go around I saw this billboard a number of years ago, and it said, "The lessons will be repeated until they are learned." And I thought about it for a second, and then it reminded me of back in the Army, we had another saying, Shaun, you probably had this one too: the beatings will continue until morale improves. And that concept has stuck with me for quite a while now, after I rehashed it in there. And that's what it always teaches me, is that, like, there's something that you're repeating incorrectly. Now you need to figure out what that is, and then fix it so that you don't have to manage this pain anymore. But it's a tough lesson to learn sometimes. We got to put our ego down and be able to do some stuff with it. But this has just been awesome. So first off, I want to say thank you, Jesse, Shaun. Great conversation on pain. We've kept it very broad, which I think is effective for right now, but I'm going to get you back on, and we're going to go do a deep dive, maybe with some other docs, and we can talk deeply about pain. Any final thoughts? Anything at all still bubbling in the back of your brain, Jesse? What do you got?
Oh yeah, I mean, I could talk for a long time about this and optimization and health, but no, I think it was a great start, and appreciate you guys having me.
Always fun chatting, for sure. Shaun, what do you got?
Yeah, it was a good introduction to the subject as a whole. And I mean, like a really high level perspective of it. And we've missed entire gaps on the subject, of course. But as Jesse said, I think that there's other areas that we should fold into the conversation, specifically optimization or longevity based protocols and treatments, and kind of living your life through that lens. So veterans as a whole could certainly benefit from a more holistic perspective on the subject of personal improvement, human betterment. So I'd love to have Jesse back on with a panel of other subject matter experts, such as, the usual that we've had on in the past on this topic.
My first thought was Doc Luke. He'd be
Me too.
perfect
Sure.
with Jess. That'd be awesome.
He'd be perfect. And those two would get along so well.
Oh yeah, absolutely. Other than that, I don't have a lot to add on to this as a final thought, other than the fact that if you're in pain, find a doctor. Like, go out and find out what it is that is painful, and begin the search, begin the journey, because getting out of pain it's worth it. Let me put it that way.
Well, it's not only worth it to you, Chance. You're an improved version of yourself, which is better for your family, and it's better for the community, and it's better for everyone who's served with you and will serve behind you. So we're not just out here trying to improve our own little lives. We're out here trying to prove it for the bigger team around us. So, if that isn't enough for anyone, then, you should ask yourself some deeper questions.
Absolutely. And while you're asking those deeper questions, you will find answers that will help you learn, build, and grow. We'll see y'all next week. Chimo. Thanks everybody for watching and being part of the collective. If this has sparked any thoughts or resonated with you, let us know in the comments. Don't forget to like, subscribe, and share. Your support helps us grow and keeps the conversation going.